Veterinary medicine is a messy business both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
All right, today we are going to talk about AAHA, or the American Animal Hospital Association. And it was established in 1933 by veterinary professionals, and it is the only organization that accredits companion veterinary hospitals. In human medicine, hospitals have to be accredited. In veterinary medicine, they do not. And so one of AAHA's roles in the profession of veterinary medicine is to help hold hospitals and veterinarians to a higher standard of care and to help promote what's called gold standard care, or basically the best medicine we can practice. And AAHA has several kind of branches or categories that it works with to improve veterinary medicine as a whole, but its entire kind of mission is to improve veterinary medicine. And the branch we're going to talk about today is the part of AAHA that involves the accreditation process. AAHA also has guidelines that it releases. So when we talked about vaccines, we discussed that we follow the 2017 AAHA canine vaccine guidelines. They also contributed to the feline guidelines a number of years ago, and my understanding is there's going to be newer ones coming out, hopefully in the next year or so. So as kind of a group, AAHA has subsections, and one of those sections are panels of veterinary experts that help kind of formulate best medicine practice. And the goal is not to dictate how medicine should be practiced. The idea is to say, okay, well, these veterinary experts have sat down, they have discussed these issues, and they have decided that this is the bare minimum or what we know that we really should be doing for our pets. And the vaccine guidelines is one example. There's a 2018 guideline about infectious disease control. And so, again, it's part of this umbrella of trying to improve veterinary medicine. And the aspect of AAHA that we're going to really go into in detail today is the accreditation process. And unfortunately, AAHA is very well known among the veterinary community, and we talk about it a lot in vet school, and then we learn more about it when we graduate. But not a lot of clients necessarily understand what AAHA is or understand really how AAHA can benefit your pet. And being an accredited hospital is completely voluntary. It is a paid accreditation, so you pay to have an outside facility come in, review your clinic, review your practices, and determine if you meet their level of standard of care. And so it's pretty intense. There's around 900 standards that have to be met. And since I am acting as kind of like the transient medical director of Montclair Animal Hospital, and they are not yet AAHA certified, I'm kind of starting from the ground up, whereas as the medical director of Independent Hill, they've been accredited for 25 years. So when I started there 3 years ago, it was more an instance of, okay, these are the standards that we've been meeting, these are the changes, and just implementing those. Whereas at Montclair, it's kind of cool because I get to review every single standard and ensure that, yes, as a hopefully newly accredited hospital, we will now be meeting those levels of care. And the accreditation process, usually it's about 6 months if a hospital is not accredited. So you kind of like sign this promissory note or make an agreement that you are going to become accredited. You review your standards that you have, you write protocols, because a lot of what AAHA is helping you realize protocols that you need for your hospital, but also saying, hey, these should be written down, because a lot of veterinary hospitals say, all right, this is how we routinely draw blood, this is how we hold, this is how we disinfect an exam room, but that protocol is not written down. So sometimes, just like the game telephone you probably have played, sometimes as things are told from one individual to another, or you get new employees, the way that you want things done deviates, whereas if there is a written protocol or SOP, which stands for Standard Operating Procedure, then it is known amongst all the employees, new and old, how that particular task should be done. So it helps ensure that you're meeting the standards of care that are continuously evolving, and it also ensures that you have it written down so that there's no discrepancy among employees and there's no confusion. The AAHA accreditation process has to be renewed every 3 years. And what's neat about AAHA is that because they're ever evolving, the hospitals can improve year to year as the standards get tweaked or are completely revamped. But then every 3 years, you have to redo the entire accreditation process again to make sure, yes, you are still adhering to all of 900 standards that they have. So I really like AAHA. I think that as an umbrella organization, it has a great message. I think that every branch of AAHA has a great role in veterinary medicine. And I think that realistically, veterinarians just need to do a better job of promoting what being an AAHA facility means so that clients understand and can see why it would be advantageous. And just so you're aware, only 12 to 15% of practices in the United States and Canada are AAHA accredited. There's a lot of veterinary practices out there, and only a very small portion of them are accredited. So it goes to show you that we have a lot of room for improvement because not all those practices are meeting all of those standards. So the AAHA mission, and this is taken from their website, www.awaha.org. So AAHA's mission, enhance the abilities of veterinarians to provide quality medical care to companion animals, enable veterinarians to successfully conduct their practices and maintain their facilities with high standards of excellence, meet the public's needs as they relate to the delivery of small animal veterinary medicine. And if you ask me, those are all great goals, and I completely buy into it. And AAHA's vision, again, this is from their website, is a world in which all veterinary practices deliver the highest quality care available today. And so if this podcast does anything, I hope that it gets the message across that AAHA really is a very important part of veterinary medicine, and it is not a required part. It is, again, a voluntary process. So practices have to generally spend hundreds of man hours, and that's the medical director, the practice manager, and the staff members, for everybody to get on the same page to say, all right, this is the vision that we have of our hospital. This is the next step that we're going to take so that we can continue to provide excellent care to our patients and improve the level of client communication that we have. So the AAHA credo, and again, this is from their website, deliver excellence every time, choose to be positive. We believe that a positive mindset can take us extraordinary places and share this positive outlook with the community that surrounds us. Embrace and welcome change, pursue innovative solutions, communicate open and honestly. And again, I think those are all excellent credos to have. I think that that explains a community where I want to work, a place where, my ideas are welcome, my positive attitude is appreciated, and we constantly want to evolve and improve. So what are the categories that AAHA looks at in order to consider a clinic to be AAHA certified? Anesthesia, that's a big one. So we have very specific pre-anesthetic procedures. Every patient is required to have an exam within 24 hours of the procedure. Diagnostics must be performed. An IV catheter must be used. A designated, ideally veterinary technician, but a very well-trained veterinary assistant has to be monitoring the anesthesia at all times. And if it is not a technician that's monitoring the anesthesia, a veterinary technician and or doctor must be in the room at all times while the anesthetic procedure is occurring. We have to be prepared with drug calculations and known drugs that we would need in an emergency. We have to have certain types of anesthetic monitoring equipment. We have to have that equipment serviced and ensure that it is always in constant working order. Contagious disease is another thing to think about. So having an isolation room, while not mandatory, is always a good idea so that patients that have contagious diseases are kept separate. But just having a room is not helpful. You need to know how to take care of the room, how to properly enter the room, how to keep everything within the room separate from the rest of your hospital. And one thing that is something that I never thought about until I started working with AAHA is the idea of positive pressure versus negative pressure versus neutral pressure in a room. So if you have a room and your door is closed and you take a little piece of cotton and you put it at the bottom of the door, assuming there's not like a seal at the bottom, that cotton can do one of three things. Nothing. Okay, so that's neutral pressure. Blow outward, that's positive pressure, or get sucked inward, that's negative pressure. So if you have an isolation room and you have positive pressure, that means all of the contaminants and basically the UC, which is the scientific term, from that room gets blown into the rest of the hospital. Not ideal. Not an effective contagious disease protocol. So even things like that, and kind of the opposite of that is your surgery suite. You don't want it to be negative pressure. You don't want to suck everything from the hospital into the surgery suite because that could be contamination. So you want it to ideally be a positive pressure room, but at least be a neutral room. The other things to consider about with contagious disease is how do you clean the exam rooms? What materials do you use? What protocols do you use if an animal had a potentially contagious disease in that room? Do the veterinarians have to change their clothes? Do the technicians have to change their clothes? Do you have to use a different stethoscope? Do you have to decontaminate your stethoscope? How do you care for a patient properly in the hospital that potentially has a contagious disease, especially if they're contagious to people? So things like leptospirosis. And in the case of my hospital, if we're doing rabies observation exams, so an animal that was potentially exposed to rabies and we're examining it to ensure that it is free of clinical signs of rabies, I want myself and my assistants to be wearing gloves. And that's not something that I initially thought about because you figure, what are the chances it has rabies? But if it has rabies, then it's going to be excreted in its saliva. So you want to make sure that your staff and yourself are protected. Dentistry. So you want to make sure that you have an entire what's called oral health assessment and treatment plan. You want to make sure that you assess the teeth before anesthesia, during anesthesia, so that includes doing measurements like they do when you go to the dentist to see if you have pocketing in your gums, to see if you have root exposure, to see if you have any visible dental caries or cavities. We do full mouth x-rays to ensure dental health above and below the gum line because the crown could look great, but the root could just look awful. And the only way you're going to know that is if you take pre-dental films. We also take post-extraction dental films because it can look like you got that whole root, but sometimes you don't. And dog and cat teeth are tricky. Unlike human roots that go straight down, our patients' roots diverge, so they stick out. So you have to do a surgical extraction. You can't do a simple pull like you would at a human dentist. Emergency and critical care is another category. So you need to have a plan for initial triage. You need everyone who could potentially be involved in an arrest situation. So when a patient suffers cardiopulmonary arrest, you want them to be trained in at least one aspect of CPR. So annual CPR training is mandatory. You want to have an idea for how you're going to manage cases, what drugs you're going to need to keep in stock. We have crash carts at both hospitals, and they're not super fancy. They're really just like those rolly plastic carts on wheels, and the top drawer is basically the emergency drawer. I'm air quoting, but of course you can't see it because it's radio. Well, podcast. So that top drawer is where we have the drugs, and there's a piece of tape that goes across there, and every month we check it, and then they write the date across it so that we know it's been checked. And if there's an emergency and we break the seal, again, air quotes, then when we are done with the emergency and we restock it, again, we put another piece of tape with the initials of the person who checked it and the date. That way we know if there's an emergency and we got to go, then we have all the medication that we need. The rest of the drawers have what I call pre-popped syringes, or basically if you have a needle and syringe combo, they're taken out of the container. It just saves you a little bit of time. IV catheter, a bag of IV fluids, a drip line that you can put in, bandage material, quick suture material. That way, everything that you could potentially need for an emergency is right there, and you don't have to send someone running around the hospital to try and gather all the supplies. Pain management. Pain is a huge thing in human medicine and veterinary medicine, so we do now use pain scoring in patients. Every patient that has a physical exam at Independent Hill and Montclair receive a pain score. So most of them are 0, right? Because they're non-painful. But if they do have pain, then we're going to mark it on a 1 to 5 scale. Pain management. We need to know what we're going to do in the hospital. We need to know what we're going to do out of the hospital. We need to know what the state laws are for prescribing controlled substances. We need to know, as a veterinary hospital, are we adhering to those state laws? And are we also adhering to just common sense laws that say, okay, well, does that patient really need an opioid or a controlled substance? Would an anti-inflammatory be better? Medical records. So electronic medical records are super helpful for multiple reasons, one of which you can always type faster than you can write. But it also allows you to have everything all at once in one location. It increases your speed of understanding what's going on with the patient, increases the ability to find all of the information. Client communication has to be documented. Your record has to be clearly organized. It needs to be confidential. All of the information that's in there. You need to have